welcome. My name is Barkha Dutt. You have been seeing our travels through the hinterland, through the villages of North India. And many of you in different states have asked, when are we coming south? When are we coming to your state? Well, after almost 15 days traveling through Uttar Pradesh and other parts of North India, tracking the bodies, the mass graves, the floating corpses in the Ganga, we are now in Karnataka. At this moment, I'm broadcasting to you from Bengaluru, or Bangalore as we used to know it. You can see behind me, I'm actually sitting at a vaccination center here in the city, at a major club in the city. But this is one of those centers that has in fact sourced its vaccines from a private hospital. The reason I'm mentioning this is because the Supreme Court today had major hell to give the center for what it called various flaws in its vaccination policy. And we'll be discussing many of those on the special broadcast. But key among the questions raised by the Supreme Court is something that we have found on the ground here as well, which is that younger people, we already know this, younger people are dying in this second wave. And yet younger people, especially between the age group of 18 to 44, are the ones who are not being able to access the vaccine. So what is the point of this vaccine rollout? It's one among many flaws that has been called out by the Supreme Court today. Before we bring you a ground report from our journey as it begins through Bengaluru, through South India, let me introduce our guests. Let's bring them up in the screen now. You can see Dr. Swapneil Parikh, physician and author, in the screen. Welcome, Swapneil. We also have Dr. Shahid Jameel, one of the country's best-known virologists. He recently quit a government advisory body on COVID. He hasn't so far told us why he did it. I don't know if he will in this program, but we'll try our luck. We'll see what we can get out of him. Dhiraj Nayyar, chief economist with the Medanta group, has also worked previously with the Niti Aayog, understands numbers like very few do. Welcome to the program. PKD Nambiar is with us. He's a policy analyst, a political analyst, and a supporter. He and I have often argued about his support for how the government is handling its vaccine rollout, and I have a feeling we'll have an argument today as well. Chandrakant Lahiriya, well-known epidemiologist, is with us as well. Now, before we actually start looking at the vaccine rollout, I reported from inside the ICU of a COVID hospital in Bengaluru today. And what this report reconfirmed was two things. One, how younger lives are being claimed. Literally, the average age of anyone we met in this ICU who's being treated for COVID was in their mid to late 20s to their early 40s. And I'm talking about the ICU, not the general ward, right? And this is something that doctors are also confirming. And the other thing is that for those who think that the wave is over in the cities, the doctors in this ICU say for them the pressure to deliver an ICU bed, which quite simply means an oxygenated bed, is still very difficult, because now smaller towns and villages are now sending people to the cities, and so it is still very, very tight. This is my report from inside a COVID ICU at this hospital in Bengaluru. We are inside the ICU of the HPS hospital in Bengaluru. Now remember, this is a city that has really reeled under the weight of COVID. And this is a city that has actually seen an alarmingly high level of fatalities. In fact, a recent study tells us that the casualties, the mortality here has been 3 times higher than, let's say, the city of Chennai for the same time period between February and the 25th of May. To understand what's happening here on the ground, even though things are somewhat better now, but they're still pretty serious. We're joined by Dr. Taha Mateen, who looks after the HPS hospital here. Talk a little bit, it's a tense time, so appreciate your making the time. Talk a little bit about the kind of casualty figures, the fatalities, as we walk through the ICU, and we'll just walk here and you can tell us. Yeah.
The mortality this time has been rather high, almost 20% in the ICU.
20% in the ICU is a staggering figure.
In the ICU, yes, it's an astonishing figure actually. 20% is a very, very large number. Once you come to the ICU and on a ventilator, they really die. But the bad thing here is we have very, very young patients. That one is 40, this is 34, this is under 30, 28 years old.
So let me ask the camera to come here as I go over what you've just told me.
Right.
You've just described 3 patients and you've said that they're all 3 are between their 30s and their early 40s.
Yeah, it's 40, 34 and 28 actually. These are the 3 people in the ICU, very, very sick. The first one is having an encephalopathy. The second one is intubated. Intubated mortality is more than 90%.
Intubated mortality is more than 90%. Let those numbers sink in.
All right. And here we have a young woman who came from Ramnagaram, which is about 40 kilometers away, not finding an ICU bed elsewhere. So she came here last evening and she was in the emergency with 35% oxygen. On 15 liters of oxygen, her saturation was very, very low. And therefore, these people, the next one is also a young man who is about 38 years old.
So I'm really staggered by the fact that literally every bed in this ICU that we've seen so far has not been the elderly as we once thought, but it has been people in their 30s and their 40s. Now, one reason for this that sometimes offered is that the elderly were vaccinated earlier. Does that explain it, or is the strain, this mutant strain, playing out differently for younger people?
It doesn't look like it's because of the not having been vaccinated. It is because of the mutant strain. The reason I say that is because last time we had this and younger people were not equally affected. So why are they affected this time? So this is a mutant strain which is affecting the younger people more aggressively.
So would you say that there are more young people in this ICU today than older?
Absolutely. There are more young people than the older people here in the ICU today.
And the average age of the patient here would be?
Would be average age would be between 40 and 50. There are some people in the younger, but 40 and 50 is a very, very young age.
I mean, that's actually younger than I am. I'm 49 years old and I don't even think of myself as old. But it really makes you reimagine your assumptions. Now, before we are seeing here the other team, the team of that works with Dr. Mateen. We have Dr. Faisal here. We'll talk to him in a second. But I just want to understand something from you. What is the biggest challenge on the ground? You spoke about a 20% mortality rate in the ICU. Elaborate on that.
Well, the biggest problem is people are not coming early enough. They are being treated with all kinds of protocol medicines which do not include steroids and the anticoagulants. Mm-hmm. So the
blood thinners.
Yeah, blood thinners. And they are on these medicines for such a long time that they come to you when they're very, very, very sick. Mm-hmm. And they are managed in hospitals which do not have those facilities, and commercialization of healthcare has really, really kind of been a challenge on the ground for us. Mm-hmm. Number one, we don't have proper infrastructure. Number two, we do not have proper regulations for this infrastructure. And that has created a crisis wherein very young people are not finding beds, are not being treated appropriately, and these myths of COVID and the stigmatization of COVID has also been a big challenge.
So let me ask the camera to come here and show you where we're standing again. We're in the ICU of the HPS hospital, and by the way, though they say that the numbers are somewhat down, the ICU is absolutely full. Dr. Faisal, for you, has anything changed? Has the pressure, thoda pressure kam hua hai ki bilkul nahi?
नहीं बिल्कुल नहीं प्रेशर तो
बिल्कुल नहीं कम हुआ
हाँ बिल्कुल नहीं कम हुआ rather this time we are, as Dr. Mateen rightly said, we have seen much younger patients. For example, this gentleman here, he's my classmate in school.
So we'll turn around. We're not going to reveal his identity without his consent, but he is the intensivist classmate, which means if we can,
he's about 40 years old.
He would be how old?
He is as old as me. He's about 40, going to be 40 now. Okay. And this time we see a lot, as Dr. Mateen said, we are seeing a lot more young patients who have been victims of COVID-19.
Acha, when they say that things have improved a little bit in Bangalore, what about the pressure to get an ICU bed? Now, an ICU bed, quite simply, by definition, means an oxygenated bed. Does that still remain a struggle?
Absolutely a struggle. Not just a nice oxygenated bed, but a bed which can give you high flow oxygen, which can give you a ventilator, which can have capabilities to intubate. Those beds are still not available. What we are seeing for the last 1 week is people are coming from towns far away from Bangalore, from Ramnagaram, from Mysore, from Kolar, from Chanpatna. All these people are coming now from across the border in Hosur and in Krishnagiri and all these. Those people are coming to Bangalore to us now.
So So it's the rural Karnataka that is then sending patients into the city, and therefore the pressure for you in terms of the demand for ICU beds has not decreased.
It has not decreased because rural Karnataka is sending it to us in the last 1 week. Otherwise, we were full within Bangalore itself.
In the hospital right now, how many ICU beds are taken?
Every single ICU bed is taken. We have about 35 ventilators in this hospital, and all of them are taken.
35 ventilators, every single ICU bed taken. Sabse badi mushkil. What is the biggest challenge that you're still facing?
We're still facing in terms of oxygen supply and.
Is that still a problem?
No, to a certain extent we have extended our resources. We have gone way beyond our capacity in fulfilling the requirements. But by God's grace, the oxygen requirement in this hospital, we have tried to manage as much as possible. We have not had a shortage like the other centers.
So what worries you? What keeps you awake at night?
The young people getting affected and.
What keeps you awake at night?
The mortality. We've been seeing grief upon grief upon grief and death upon death, coming closer and closer to our families and relatives and people who we know as well.
You were talking about the class differential this time as well.
Yes. Because in the first wave, it was predominantly in the lower socioeconomic class, in the poor class, and the people who live in slums. Almost 80% to 20% who are like in the middle and upper middle class. This time, the ratio is reversed. About 80% is middle and upper middle, and 20% is from the lower socioeconomic.
I sometimes call the second wave the 2611 of the health world.
I would agree with you. It's been terrible. This many deaths we haven't seen. 2611 was nothing in comparison to the COVID crisis.
And 20% mortality in your ICU. Have you ever seen that before?
No, we haven't seen this kind of mortality. Bodies upon bodies that we're picking up. It's very painful, Barkha. It's hard to take.
It is heartbreaking, and it's a reality check here in Bangalore where, yes, the peak of the city may have shown, you would say, some signs of decrease, but for those who work the ICU, the pressure is just as much for an ICU, for an oxygenated bed. Now, in the middle of this heartbreak, there is one patient behind us who wants to share her story, who's doing better. I'll first ask Dr. Mateen to just go and maybe look her up, and then we can have a word with her. जी वालेकुम अस्सलाम. नाम क्या है आपका?
मेरा नाम शमशाद है.
अच्छा, आप तो बहुत बेहतर लग रही हैं. मुझे खुशी हुई.
मैं बहुत खुश हूँ. और जो है यहाँ हर किसी का जो है ये है आगे बढ़ के ये करना है.
मतलब आगे बढ़ते रहना है.
आगे बढ़ते रहना है, खिदमत करते रहना है. वक्त का कोई देखने वाले नहीं है और अपना थकान नहीं है. और
कितने दिन से आप आईसीयू में?
वही 1 महीने से हूँ.
1 महीना?
हाँ.
तो इनको 1 महीना हो गया है. दैट इज हाउ लॉन्ग.
जैसा करते हैं ये लोग,
घर जैसे.
और कोई चीज़ की कमी नहीं, दिन रात दवाई नहीं, ऑक्सीजन नहीं, किसी की खिदमत में कमी नहीं, कोई ये नहीं.
अपना फैमिली में और किसी को भी हुआ कोविड?
नहीं है. देखिए, मैं अकेली औरत हूँ, लेकिन ये मेरे भाई से ज़्यादा.
आपके हस्बैंड को भी कोविड हुआ और अच्छे हो गए ना?
हाँ, उनको भी हुआ था.
यहाँ तो लेकिन बाकी फैमिली में हुआ था ना लोगों को?
हाँ, फैमिली में हुआ.
अच्छा, अभी सबसे जब आपको बहुत बुरा लगा कि आप बहुत बीमार हो, तो क्या लगता था? सांस नहीं आता था?
हाँ, सांस नहीं आता था, खांसी होती थी और बुखार था, सर दर्द था. लेकिन जो है इन लोगों की हिम्मत ने जो है मुझे आज उठा के खड़ा कर दी.
Okay, I just thought it was necessary after all that gloom and doom from the doctors in the ICU who underline the fact that this 20% mortality in this hospital's ICU, that it is young people. And literally while Dr. Tahar Mateen there said the average age of patients was between 40 to 50, every single patient he showed me in the part of the ICU I was in was in their late 20s to early 40s. The reason I raise this is because this is the age group that isn't being able to get vaccines. Right? And that is something the Supreme Court has raised today. In fact, a 3-judge bench said to the center that this, giving it to those above 45 may have made sense in the first wave. It doesn't make any sense for the second wave. They also question the differential pricing, the differential procurement. Remember, states have a different price, centers have a different price. Private hospitals, private clubs like the one I'm sitting in Bangalore can procure vaccines from a private hospital and charge differently for them from a government hospital. But the big crisis remains the shortage of vaccines given this this level of mortality. Shahid Jameel, I'll start with you. We've already seen people declaring the end or the worst being over of the second wave. But the fact is that if you look at just the death data, which anyway we all think is underreported, but even if you look at the official death data, it isn't actually showing you necessarily a decline from April to May. In the city I am in Bangalore has shown a 3x more deaths than Chennai. The city is trying to understand why. You heard the doctors in the ICU. It's late 20s to early 40s lives that are being claimed. The vaccine policy. I mean, how much does it worry you where we are?
Well, I think, Barkha, the main thing that worries me about the vaccine policy is this center versus state versus private. Historically in India, vaccines have always been procured by the center uh, because the center can procure large amounts and get better pricing. Honestly, the states have no experience in procuring vaccines. And now suddenly states have to compete with private players. I think that's a bit unfair. Uh, so this is something that worries me, that equity and access is really going to suffer.
But what about the actual shortage and the age group, right? If you look at the fact that doctors are now saying on record that younger lives are being claimed, and the old theory that it's because these were groups that were not vaccinated is not something that doctors at the front line are convinced of. In fact, I think data from May shows you that 50% of all deaths between the 1st of May and the 24th of May, if I'm not wrong, were those in this age group, right? If we can bring up that banner, yeah, there, 50% of COVID cases were in the age group of 18 to 44. We know this now. I saw it just now in the ICU. I've seen it in my travels. You can say it's anecdotal when I say it, but the doctors are saying it. And this is the group that's not getting vaccinated, Dr. Jameel.
It's always going to be a question of how much vaccine is coming through. Uh, and unfortunately, vaccine supplies are a problem. So, if you were to prioritize, obviously you'll prioritize people where you see the highest mortality. And historically, highest mortality is in older age groups. So I really think that the government's initial plan was a very sound plan. Uh, and this change of track has caused a lot of confusion. I wish that they had stuck to that plan and really vaccinated at scale in the population with the highest mortality.
I'm
Why we
still
are
going to
seeing,
I'm still
yeah,
going to argue that with you because I know you say it and I know I've heard Swapneil say it before. But when we travel and we go to these ICUs and we see people in their 20s and their 30s and their 40s dying, and in fact, you're not even seeing the elderly in these ICUs. You're barely seeing them. You're seeing young people in these ICUs all the time, no matter which city I go to.
no, I understand that, Barkha. I mean, if 2 billion doses were available today, yes, of course, give it to everyone. But if that is not available for whatever reason, you can debate it. Then you have to prioritize. Now, how do you prioritize? I mean, you prioritize based on data, and that's why I keep coming back to the the need for good data. If you don't have good data, how do you plan? And if there is anything that's been a casualty in this pandemic, that's been data, and that really has not allowed us to plan and roll things out properly.
Yeah, but this is a crisis, and Swapnil, you've been warning against the premature closing or the announcement that the second wave is over. Let's prepare for the third because you're not convinced that the second wave is over. When you go into ICUs of the kind that I've been into today, which are not giant hospitals but medium-sized hospitals, an 85-bed hospital where every ICU bed is taken, where there are 35 ventilators, where I'm telling you, I counted the people in the ICU the section that I was in, and there wasn't a person above the age of 40. And then you look at the vaccination program, and this is the precise question that Justice Chandrachud of the Supreme Court asked the center today. Why are there no vaccines for the 18 to 44 age group?
No, but I understand, and I
Can I?
completely,
Yeah,
I
yeah,
completely understand, and I completely empathize with
yeah.
people there. You know, my own sister-in-law is 45 years old, and she's been in the COVID ICU in Lucknow Medanta now for 1 month. Her oxygen has gone from 15 liters now down to about 6 liters in 1 month. I have lost two very close friends. I've lost another cousin. All of us have these stories to tell. Uh,
Yeah.
you know,
But
uh,
yeah. But are we
the,
doing the wrong thing? Let me take that. Let me take that to Swapneil Parikh, Dr. Swapneil Parikh. Are we? The Supreme Court believes that the targeting of the it's not just the volume. The targeting is wrong, given the category or the age group that is dying this time.
So, Barkha, let me just contextualize. Let's say we have 1,000 people, and of those 1,000 people, 900 are young people, and 100 are elderly. Now, let's say a virus starts spreading in these 1,000 people. Because a smaller subset are the elderly, we may see more deaths, more absolute deaths in the younger age group. However, it could still be that the elderly have a higher fatality rate compared to the other group. So that's what we're seeing in India. The younger age groups account for the vast majority of our population. The 65 plus age group accounts for only about 5% of our population. But if you look at the fatality rates, the infection fatality rate, about 1 in 10,000 at around 25 will die, but about 1 in 6 at the age of 85 will die. So the infection fatality rate is very different for the elderly versus
But
young
then,
adults.
but then, why did we see in that ICU a 28-year-old, a 35, 38-year-old, a 41-year-old, another 40-year-old, which is what we're seeing in ICUs across the country,
Because there
Swapnil?
are far more, the absolute number of people who are young far exceed the number of people who are elderly. So even though the elderly on a case by case basis are more at risk, because there are more young people, therefore you will see more young people. Also, we have to consider that the age group between 20 to say 50 needs to go out more, is more exposed because they are working, they're trying to earn money. So the exposure rates are different. However, the age-wise infection fatality rate, there's no question it's skewed towards the elderly. What you have to also remember is a lot of elderly, a certain percentage in the metros have received one dose. So there is some efficacy against them getting
So
hospitalized
I so I
in the
want to bring
elderly.
up this so I want to bring up this one dose with Swapnil and then I'll open it up. The United Kingdom just did a study which found that the AstraZeneca has a little over 30% efficacy at one dose against the mutant strain that is currently ravaging India. Even at two doses, that efficacy is a little over 60% compared to, if I'm not wrong, please correct me, I think about 88% for Pfizer, right? So this is what we're dealing with. We do not have the data for Covaxin. We do not have the data for the Bharat Biotech vaccine. So, and the government has rejected this UK study or ignored it. I don't know. I don't know which word to use. So, given this, Swapnil, I mean, I just find it very problematic that we're just telling our working population that, you know what, you're the second priority. You're the people who have to go out. You're the people landing up in ICUs, but we don't have a vaccine for you.
Yeah, absolutely unacceptable, Barkha. As I've been pointing out since the beginning of the year, we needed to scale manufacturing and distribution on a war footing. But just coming back to what you said, that the younger people are being exposed. We have created a situation where we don't have vaccines. Talking about, so even if the right thing to do is, of course, to vaccinate them, but we don't have enough. When you're talking about the UK study, I'll just touch upon that. Efficacy can be against asymptomatic disease, against symptomatic disease, against severe disease, hospitalization, and death. So the emerging data and its early data suggests that the efficacy of a single dose with AstraZeneca is particularly hit against symptomatic disease. However, we hope that the efficacy against hospitalization and death will be preserved. What
Mhm.
models do suggest is that if the single dose efficacy against hospitalization and death is somewhere around 80%, and your daily vaccination coverage is less than 0.3% of the population, then it actually will save more lives to go with a single dose prioritization. However, some media outlets have also reported that the government is toying with the idea of possibly skipping the second dose altogether. And if that is the case, that is a disastrous suggestion. We're taking a proven vaccine regimen, which is a 2-dose regimen, and we're talking about breaking it. I can understand delaying the second dose in a moment of crisis. We can debate that back and forth. I don't think there's any debate that scientifically this is a 2-dose series, and eventually everyone needs to get their second dose.
I mean, and I would just say that at least going by other data available, even at 2 doses, it is less, it has less efficacy than the mRNA vaccines, but it needs those 2 doses because at 1 dose it has very little efficacy, at least going by international studies. But the real elephant in the room is that there are no vaccines, and Dhiraj, the government has claimed in a statement, official statement from Minister Javadekar now, that it will be able to vaccinate everybody by the end of December 2021. That's in 6 months from now. This is the same statement that it has placed before the Supreme Court. The court is also not convinced. It's asked the government to provide more details. I certainly don't understand what math they're doing. Where are these vaccines going to come from? Yes, the government says that there will be 120 million doses compared to about 80 million for the previous month, but that still doesn't take us anywhere near the numbers we need. And at these numbers, at this pace, it will take another 4 years for this country to be vaccinated. Dhiraj, can we unmute Dhiraj? Yeah.
Yeah. So I think the first thing that worries me about the government statement and the minister's statement is that the person who's promising or the agency which is promising you 100% vaccination by 31st December is not the one in complete charge. As Professor Jameel said, if the government of India had taken 100% charge of procurement and distribution, then perhaps I'll come to the numbers in a second, but then at least they were in a position to guarantee or in a position to actually implement that promise. Right now, all they're going to do is procure 50% of it, and the rest has to be procured from the private sector and state governments. I'm not so worried about the private sector, though even that is a struggle. I'm 43, and it took me about 3.5 weeks, Barkha, to get an appointment after I'm willing to pay. So even that is not easy. But that said, I mean, I'm worried about the state governments, and I think Professor Jameel alluded to that. But somewhere between, I mean, things may fall through the crack between center and state. So even if we have a certain number of vaccines, I'm not yet convinced that we'll be able to deploy 100% of them, because are the states doing enough? Are they doing it correctly? Will they actually even be able to procure what is available? Forget what is not available right now. So I think that is my big worry. And the second thing I think is that now we are rallying after the second wave to correct the vaccination strategy. So I think the first error we made in that correction process was this messy division between center, state, and private. But I think, we have only 7 months left in the year. Let's also face that 5 months are gone, and we've done barely anything. I mean, the coverage, double dose coverage is 3% or 4% of the population, as in those who've been vaccinated by both doses. So I think realistically, and if you include children in the universal vaccination, it's not going to happen by December 2021. I think it's very, very difficult to assume it will happen.
Yeah, I don't know when they say they'll vaccinate everybody, do they mean children? Because we saw that Nirmala Sitharaman tweet where she said children are not being vaccinated anywhere, though Pfizer is cleared now for vaccinating a certain age group.
I mean, everybody should mean children as well, now that other countries have cleared it for children, and children are definitely are a significant part of our population, and they will be vulnerable. But even if you count just the adult part, you still need 190 crore doses, right, for 2-dose vaccines, which are our primary vaccines right now. We don't know if and when we'll get a single dose vaccine. Frankly, that could be a game changer. If somehow we could get Johnson & Johnson in a massive quantity, or Sputnik Light, 1-dose vaccines could be a game changer for India. But so far we don't have it. We don't have it on the horizon. So double-dose vaccines, I still find it very difficult to imagine they're going to get it, because I don't see either the state or the center so far placing those orders and paying that money upfront, because vaccines are not something which are made in 1 day or 2 days in a factory, right? There's a complex process, there's a complex set of materials required. It takes time, quality has to be maintained. So until I see those orders being placed at a much higher rate, and those advances being paid by both the center and state, center may still do it. But again, let me flag states. How many states? I don't think any so far have actually placed orders or paid in advance. So if that is the status right now, with 7 months left in the year, if this whole process is going to take another 2-3 months, then, theoretically, yes, we may get enough vaccines. There may be enough capacity. We can mobilize every factory in the country. We can mobilize every company. But somebody has got to place those orders and pay the money as well. It's not going to happen automatically. That's what I'm worried about.
Yeah, and in the meantime, what's going to happen to those who are in those ICUs contracting COVID anyway? By the time they get to hospital, it's too late for them. But the fact is that there is a certain age group which maybe Swapneil is right, that by the sheer numbers it is showing a sort of a greater fallibility there.
We've discussed this on your show before, but even December is very late for a lot of people. If there's a third wave, that even December might be too late for a lot of people, as we are seeing, younger people dying in this phase. I mean, God forbid, it could be more younger people or children in the next phase. So, I mean, the vaccination strategy has not been correct, but I think December is also too late. If it goes beyond that, then we are leaving ourselves vulnerable to a third wave or a fourth wave at some point. So I think, again, let's get our act together. This center, state, private confusion falling between the cracks, this will just delay things. I still think it's not too late. The center can take it back. The states can surrender that power to the center and make sure that we have those vaccines. I think that is really, there's no other way out of this pandemic.
But we're still slow moving. We're still, and I'll come to Chandrakant on this in a moment. But PKD Nambiar, as someone who has defended or justified or rationalized the government's vaccine policy, what is the justification? I mean, no matter which way you cut and splice the data, the government did not order enough vaccines, did not manufacture enough vaccines. 1 minute, let me just ask my question. Then it over-centralized the vaccine rollout by not giving the states power. For example, Maharashtra early on to do door-to-door inoculations, the center said no. And then it completely liberalized it by basically leaving the states to go and buy their own vaccines. So there's complete confusion.
Well, Barkha, there is no doubt that there are confusion. Some of these confusions are created maybe because of the policy which the central government has come up. Some of these confusions are created by the so-called opposition and some section of the media. Let me now, one of the biggest challenge today, what we are having is that we are today on 130th day or so of vaccine launch in India. We are discussing about the vaccine not available. Whereas the true data, if somebody really wanted to understand the real data, I feel proud with the fact that a country of us, wherein some of a very respected leader, very, very scholarly leader once said that the India is still a snake charmer's place, have been able to create its own vaccine. And we are the second country in the world after the US who has done more than 21 crores plus vaccination. So I am saying that this is the first time in the world there is a universal vaccination drive is happening. We are talking about 135 crore people to be vaccinated. Everything, whatever we look at from the point of view of a negativity, 130th day, we are expecting 135 crore people to be vaccinated. Forget about that, the kids and everything. 100 crore people. I wanted to actually give you some facts because that actually opens it up. Forget about, I am saying that even today, I don't trust the actual data which is coming from the government as it is, because those data, I come from a background of data, so I understand it. It cannot be accurate. Even in the US, the data which you get is not accurate. Now, let me tell you, in the month of January, when we have launched, do you know that how many states, I want you to do a series of programs, the amount of vaccines we have wasted only because of some of the states, their efficacy. I'll give you the exact data. India has wasted 4.6 million doses so far. 4.6 million doses have been wasted. So before we start criticizing our government, this is not like a bread and jam that any second day and another.
Okay, you make a good point on the vaccine wastage.
Barkha, you have to
Okay, quickly wrap. I need to go to Chandrakant. Yeah, quickly close your argument. We can come back to you.
I'm only saying that we all have the right to criticize a government. We all have the right, because at the end of the day, elected government is the one which is answerable. We should criticize. But some kind of a people like us who are learned, we are educated, we have seen the world, let us criticize little practically. You cannot vaccinate the entire population of this country this way. 11% of the people in this country have been received at
Okay.
least one
Let
dose
me
of. Why
let me
don't we
take what you
that fact? I have a
because
problem. I think whatever you say, I have only one problem which I have with the government. I must tell you. That is why this 2, 3 different set of prices. That is something which I have a problem. But
okay.
other
So you have a problem with the pricing, not the pay. Okay. I've got your point. Now let's move on to Chandrakant. I've got your point. You have a problem with the differential pricing, but not with the pace. You're saying in absolute numbers, it's a big number. We're a big country. I would still say, the fact is, if we had taken the warnings of a second wave seriously, manufactured more, purchased more, they're still back and not got obsessed with a Indian vaccine or an Indian-made vaccine, we would once again now PKD. Let me go to Chandrakant. Chandrakant, given the pace at which we are proceeding, even adding the 120 million doses that they say will be available in June, what is going to happen to our younger people? Because at the moment, if you're between 18 and 44, it is impossible to actually get a shot. Very difficult, at least.
So thanks, Barkha. So what we know that 120 million is on the projected line that we between May to July 2021, it was projected that in the May 80 million, then June 120 million, and July another 120 million vaccine will be available. I don't foresee that there will be even a bigger enhanced availability starting August 2021, as governments say, because we have already discussed that vaccine production is a complex process. Bharat Biotech has a few days ago announced that it takes 4 months to produce vaccine, a particular lot or batch. So this is going to be a slow process. Now, the shortage of availability at the target population, which want to be vaccinated, we have already discussed. So now the key discussion should be how to prioritize the available shots. My real apprehension or fear is that while we are discussing that who should be vaccinated, but the vaccine supply is limited. The target population is 940 million population, while the vaccine availability is 120 million shots a month. So we have to prioritize and identify for the target population. Nearly every panelist has said that the government has made a mistake by opening to additional population. Vaccination is done with the specific purpose of reducing mortality and morbidity and severe disease. We have heard that.
Are you all agreed that these people that I meet in the ICUs of COVID hospitals, Chandrakant, cannot be prioritized for vaccines, even though they are the ones coming most often to hospital ICUs now? And there's a staggering increase. 50% of all cases were in that age group. So you can no longer argue. Yes, I understand at an individual level, the infection fatality rate is more for an older person. I've understood that math. But in absolute numbers, 50% of all deaths are taking place of the 18 to 40 or 44 age group.
That is true. But we also know, and as has been already been explained, that the target population group is really high in this one. And when we have a limited availability, we have to prioritize. That's one part. But it also depends upon where we are going for this thing. What you saw in ICU or we see in various hospitals is also dependent upon the absolute number of cases in this wave was 4-fold higher than the previous wave. And the number of facilities, the ICU beds, oxygen beds were limited. They did not increase 4-fold between the first wave and second wave. So what one would see in a hospital is dependent upon where you end up. If you go to a private hospital, it's more likely that the people who are in the working class and who have an insurance policy and something, so they were admitted in that particular hospital. If you go to a government hospital, you will find people who are not covered through insurance policy, or poor people will be admitted. But the fact, nobody can deny that all age group were affected. Now, I really wish, and many people agree, that each one of the adult population should be vaccinated. But we realistic that we don't have vaccine, so how to prioritize? And that's a key challenge. The prioritize means do it really well. We started with the 60%, 45%.
So none of you believe on this panel, I just want to make sure, and if anyone disagrees, please raise your hand so I can come to you. None of you believe that it is that the working population, because there has been one school of thought that has said that the working age group, the one that goes out, that will then take that infection back home to the elderly at home, is the one that needs to be prioritized. And this classic approach that give it to the elderly possibly is not the most sound approach. Does anyone buy this, or you all think, Swapneil, you want to come in there? Yeah.
So, Barkha, let's be very clear. We're not saying that the young people do not deserve to be vaccinated. What we are saying is that there has been a catastrophic failure of planning and vaccine procurement, which has led us to a crisis scenario where there isn't enough vaccine to do the right thing. So, therefore, we have to use an extremely scarce resource in the way that's going to save the most lives. And therefore, vaccinating elderly people is going to save more lives than vaccinating younger people. Not taking a moral position on this. I'm just saying, within the situation we're in, our hands are tied. We don't have enough vaccine to do the right thing.
Yeah, but given the fact that we don't have enough vaccines, what should we do? Shahid Jameel, let me take that to you. And I have to preface it by a question. And that question is this: you hit the headlines for actually walking out of a government advisory COVID body that you were on. Till this date, we do not know what made you do it, but we do know from other public utterances, including on this platform, that you have been disillusioned with the handling of the COVID crisis. You were disillusioned with the mass rallies. At that time, I remember you said, we've lost the plot, especially given what was happening in Bengal. You warned that this is going to possibly lead to more new mutant strains. I have to ask you, what made you walk out of that body? And I ask you this also because somewhere it must tie into your general assessment of how we're handling this crisis as a country.
Barkha, I think there are more important things to discuss, and certainly vaccines and vaccine rollout and vaccine policy is far more interesting than why I did this or that. So,
but something must have made you do it. Some policy, some tipping over moment must have happened for you.
Yeah, I mean, things happen, and it's not important for us to get off track about irrelevant things. Rather, focus on the vaccine policy.
But was it
vaccine
personal or was
rollout.
it policy? All I'll ask about this last question is: was it personal for you, or was it in disagreement with the government policy?
Well, I will still reserve my right not to say anything on that.
Okay, fair enough. So, fair enough. Given this shortage of vaccines that Swapneil has alluded to, given that all of you have said, of course, these young people deserve to get a vaccine, but the vaccines don't exist, is it correct? And I know I'm going to say something controversial here, but does it make sense to keep prioritizing the elderly when half of those dying are in a different age group? Shahid?
Yeah. Barkha, I mean, I said this earlier, Swapnil said it, and I think everyone has said this, that if sufficient doses were available, then we would not be even asking this question. But yes, the fact is that in a pandemic, a vaccine is supposed to do three things for you. First is to protect your frontline workers. Second is to reduce mortality. And the third is to break the pandemic. We haven't really fully done the first two yet because of various reasons, both procurement as well as our own hesitancy. I mean, initially when vaccines were available to healthcare workers, data shows that less than 50% healthcare workers took the vaccine. What's the excuse for that? So, let us stick to a plan and not be emotionally driven by this or that. Because if we are emotionally driven, we are not going to really do what vaccines are supposed to do. And by the way, if we think that vaccines are going to end the second wave, we are mistaken. It won't happen. We are vaccinating now to mitigate the third or subsequent waves. So my plea is to keep an eye on the ball here, and let us not make these policies which make it difficult for states to get vaccines. So I would again say that if it is possible for the center to take charge of the vaccine procurement and distribute it to states as needed, that will move things much faster. Let us not look back. Let us look forward to vaccinating as many people as we can.
let me just take this to Dhiraj. Dhiraj, a lot of questions have been made about, a lot of points have been made about the vaccine wastage in the beginning. Does that really explain anything? Does that really explain the numbers that we are seeing? Dhiraj, unmute yourself, please.
The vaccine wastage again shows that the strategy was wrong, because it was only to be expected that there would be some amount of hesitancy in the beginning, because the vaccines are new. Covaxin had not gone through phase 3 trials yet. So I think from the very start it should have been opened up to a bigger set. So healthcare, frontline healthcare workers plus over 60s should have been in the first group to minimize wastage, right? So you should have had more people in the earlier groups, and second round could have opened up to 45. You would have got many more people vaccinated. So vaccine wastage, I think, again, is a miscalculation of demand and supply by the ones who are making the policy. So I think there have been plenty of mistakes made, and perhaps it's inevitable when a crisis of this scale happens, and when a second wave of the magnitude that happened took place. But I still think it's not too late. We need to get on with it. Place the orders, pay the money, make sure the vaccine is scaled up. Otherwise, 4 or 5 months later, we'll be back here discussing, what happened with the third wave. Why did we lose so many people in the third wave? And I think in terms of the younger people, I think again, I think last time in the first wave, some of the advanced countries took that call. Particularly when hospitals were overwhelmed, they actually gave priority to younger people for critical care, because they said, do you save a life over 75, or do you save a life which is 45 or 40? Now, those are very difficult choices, and as doctors or as medical professionals or as policymakers, one would rather not make those. Saying that save this group, but inevitably you're doing that, right, Barkha? Right now you're saying save the over 65s. Too bad about the.
That's what, I have a huge. Yeah.
But that choice is implicit in the policy, and I think. That's that. I mean, and I think there needs to be hard thinking on that as well. If we are not going to be able to vaccinate the entire population before December or January or February, whenever, we also need to start thinking about the younger people and whether we need to save younger lives, which have a more productive future, which have a much longer future. I mean, I know these are very difficult questions and a lot of ethics and morality and all, but we are making those choices one way or the other. Given the shortage, we have to make those choices.
Yeah, absolutely. And it's a very tough conversation, but it's the elephant in the room. And now I just want to, before I come to Mr. Nambiar and to Mr. Lahiriya, I just want to, this is a conversation that's now getting deeply politicized. You have the opposition versus government on this, you have states versus center on this. Rahul Gandhi and the Congress have accused the government of what they call vaccine profiteering. So even if you ignore the political parts of this comment that we're just going to play out for you, it would be worthwhile to also look at how the politics are hurting or helping, especially given the center versus state fault line that has emerged in this vaccine rollout. This was Rahul Gandhi on the vaccine program.
कोरोना के रोकने के 3-4 तरीके हैं. उन तरीकों में से एक परमानेंट सॉल्यूशन है, वो है वैक्सीन. लॉकडाउन हथियार है, मगर इससे लोगों को कष्ट होता है, दुख होता है, दर्द होता है. तो ये सॉल्यूशन नहीं है, और ये टेम्पररी सॉल्यूशन है. सोशल डिस्टेंसिंग टेम्पररी सॉल्यूशन है, मास्क टेम्पररी सॉल्यूशन है, वैक्सीन परमानेंट सॉल्यूशन है. फर्स्ट वेव ठीक है, उसमें बात समझ नहीं आई, वो अलग चीज है. मगर ये जो सेकंड वेव है, ये प्रधानमंत्री की जिम्मेदारी है. प्रधानमंत्री ने जो नौटंकी की, प्रधानमंत्री ने जो अपनी जिम्मेदारी पूरी नहीं की, इसका कारण सेकंड वेव है. और मैं देश को अभी बता रहा हूं, अगर वैक्सीनेशन इसी रेट पे चलता गया, मतलब आज के प्लान पे अगर आप चलें, तो मई 24 में हिंदुस्तान की पूरी जनता का वैक्सीनेशन होगा. अगर इस रेट पे वैक्सीनेशन चलता गया तो थर्ड वेव आएगी, फोर्थ वेव आएगी, फिफ्थ वेव आएगी। क्यों आएगी? क्योंकि आपका वायरस बदल जाएगा, म्यूटेट कर जाएगा।
So what do you all make of the core of that argument? Who wants to take that? I'll give Mr. PKD Nambiar a chance because I'm sure you won't agree, and then Chandrakant can come in on the science of it. Go ahead, Mr. Nambiar.
As I said, that one of the biggest challenge today is that over politicization of anything and everything. Even a crisis is highly politicized. I'm not talking about only an opposition. Maybe that may be the way an opposition is supposed to be in India. The same Rahul Gandhi, for an example, has even in the month of January and February, if you had this video bite, you could have actually put it across, even for everybody to understand. He was talking about the efficacy of the vaccination which we are producing. The whole question mark. As the other panelists were talking about, there was a challenge in the initially. The people were not, even the health workers were not ready to accept the vaccine. You know why? The Kejriwal, Rahul Gandhi, and some of the other people were talking about the efficacy of the vaccine. That led to the wastage of vaccine. Even today in Chhattisgarh and Jharkhand, 37%. Even today, when I'm talking to today, as the data of 7 a.m. It can be wrong, but 37% is a waste is the vaccine. In the one of the most progressive state, which is your neighbor state where you are right now, is in Tamil Nadu. You give me 1 minute, otherwise there is no point of me coming and sitting. I'm saying that, for an example, in Tamil Nadu, 15.5% is the vaccine is getting wasted. What we all need to understand that the people who understand the basics of maths understand that this cannot be done in a country like India so quickly. This is not something like any other factory, or in I have a factory where I ask that you are come and make it. We have been able to make a PPE kit or a mask, but vaccine is not a PPE kit or a mask that any second household can create.
Okay.
Second, there needs to be so. All right, it's as you wish.
One sentence more, then I'll go to Chandrakant. Complete your point.
So what I'm talking about is that the only way to ensure that the vaccines are available for all of us, the only way to ensure that there is to bring some amount of a positivity amongst the people, don't create more and more fear. Initially, when we created a fear that the vaccines are bad, then we have created these things that the prices are very high, people are going to die. Then we are now saying that the vaccines are not available. Is there anything good happens in this country? I don't know. Nothing happens.
In the
Modi is the one. Let it be. You say that Modi is bad, Amit Shah is bad, the doctors are all right wing. Everybody is bad, but
this is not right wing and left wing. 1 minute. Okay, I'll let someone else respond. Why am I responding? It's
Barkha, just 1 point on the data. 1 point on the data. I agree that it's it's a very big country and it takes a lot of effort to vaccinate it. But I'm just again curious that when we also interpret data as we like. So on vaccines, we want to take the absolute number. On deaths, we want to take the per million number, right? Because that suits the narrative better. So, I mean, data, there's data, you torture the data, it'll confess to anything,
Yeah, so, absolutely.
And unfortunately, as Professor Jameel said,
I want to study economics and data. That is my core area too. Let's talk.
I'm not saying
Let's talk on the data. Let's talk on the pure data. I hold the entire data with me. I am saying the government data in this country, I don't believe it as it is. But even there is no other data available, because all the other data which you come from any of the manufacturing companies or the foreign data are all motivated. I am only talking about, let's talk about the data which you have, whether it is from any of the private companies or any of the vaccine companies, any of the international countries which has vaccinated and versus India. I am saying that in India, the governments have done so much of bad things. Their strategy may not have, but in the meantime, in a crisis, every decision is taken from the point of view of a dynamic. Whether it is a crisis is always a dynamic situation. Barkha, you have covered the Kargil war in so much like a soldier. Tell me, is the army on the borders take a decision strategically every day differently? So yes, in a crisis, every decision by any government, forget about Modi government or a Kejriwal.
Okay, can I come in now?
No economist can ever
come with
a proper data in this country.
Okay.
You tell me one data.
We all
which
agree that we all agree that the data is flawed. But I think Dheeraj's point is that you can't say that you can't take absolute numbers for one benchmark and percentage of population for another, and that's what happens with deaths and vaccinations
No,
a
no,
lot
no.
of
This is
time.
precisely
Okay,
my
I have
answer.
to move on.
I am
I
talking about
PK
different
Mr.
two
Nambiar,
data. I am
I have
ready to give
5
you
minutes left. Okay.
contest that data.
Okay, you
I am
cannot
ready
now.
to give you the
Sir,
real context of
I
that.
think you've spoken a lot now. I need to go to Chandrakant and then we have to take last comments. Here's the question. What should happen now? What can happen now? What can happen? We are not even talking about what can happen and what should happen. So that's where we should focus our attention on. Chandrakant.
So the first thing which should be done, that we should not forget that there have been many mistakes made in starting January 21 to till now. And these mistakes have been made by the government, policymakers, citizens. And unless we recognize those mistakes, we will not improve upon those areas. That's one. Secondly, that it seems that we are still in some form of denial and we are not acknowledging. And that is even bigger error we are going to commit if we do so. What should be done now? As we are coming out of second wave, as it seems, first thing should be done that vaccination policy need to be re-examined, relooked. It's never too late to do the right things. Everybody agree that vaccines should be single price for all sectors, free for the citizen, and central government should be purchasing. So we know that 3 months, what is the pipeline of vaccine? Prepare and design a policy and keep the commitments or what government is going to do real, so people know that what are their real expectations. Then the vaccines are going to be available in August to December. Now also we are not, what we are hearing a lot, that there would be vaccines, but there is no decision or no planning that once the pipeline of vaccines become available, how those will be utilized. So that kind of planning need to be done. We also need to keep thinking about the third wave strengthening healthcare system. We know much of the healthcare infrastructure was dismantled by February 2021. We know that much of this pandemic second wave has been responded by the private sector healthcare facilities. Government healthcare facilities were hardly providing any services. We know that people have spent a lot of their money. They have sold their gold and then put their properties on this thing, and so it has cost a lot. So we also need to start thinking of looking at all the promises which government made starting April 2020 till now, and many of those have not been followed through. We also need to look at data and honestly and acknowledge these challenges.
Yeah, of
So
course.
there are not many things which need to be done.
But now, what do we do with the available current availability? Swapneil, you have been going on about our failure to close Pfizer and Moderna because we have refused to offer the indemnity that they seek. This is also something that has divided medical practitioners, not in terms of needing the vaccines, but over the indemnity issue.
Who is indemnifying against COVID-19? When people were sick with COVID-19, they were made to sign waivers saying that if the hospital could not give them oxygen, they would die. Who is indemnifying against that? We have to contextualize that the mRNA vaccines in trials and real world data have been amongst the safest. One of the vaccines we have deployed in India, an excellent vaccine. I've taken it. If you have the opportunity to take it, please do. But does have some safety concerns that the mRNA vaccines don't. The mRNA vaccines have amongst the highest efficacy and real world effectiveness against variants. They generate the highest titers of neutralizing antibodies. They've been used safely in children. They've been used safely in pregnant women. Pfizer has agreed to give India not-for-profit pricing. They have agreed to let us skip the queue and get 50 million doses this year. We should be going to Pfizer and saying, take your indemnity. We'll pay you a little extra. We'll give you real-world data. Give us 100 million doses right now, or give us 200 million doses right now. We should be doing this with every manufacturer. We have zero bargaining power right now. We are in a crisis. We should be begging for whatever vaccines we can from wherever we can get them. It's an absolute crisis moment, and we're talking about indemnity. We know there is a huge risk with COVID-19, a huge risk. The vaccines are taking that away. They are reducing your risk of infection by 20-fold. They're reducing your risk of death immensely. They're taking away a huge known risk, and there may be some minor hypothetical unknown risk that we can't quantify. Who's indemnifying you against COVID-19? No one. We're okay with a lot of risk when it comes to people dying of COVID-19, but not okay with some risk. And when we say indemnity, people who have adverse events should be looked after. That is the responsibility of the state healthcare system. They should be.
I actually agree with you. PKD Nambiar, you said you had a problem with the different pricing of the vaccine between the center and the state, between private hospitals and government hospitals. Speak to that in your last comment.
I personally believe that there are some of these communication or some of these strategy has really worked bad. I mean, at least to create some kind of a confusion. I'm still to become 45, so I personally thought I will not go and jump the queue or use my resources to go and get vaccinated. But then sometimes I feel that I should have done it. There is so many people who go again and get mobility. You can afford it and you go and buy it. But then there is too much of a confusion amongst the people that state is buying on another price, the center is buying on another price, and the private companies are buying on another price. I believe that is something which I personally believe that is wrong. But on the contrary, there's one last quick comment. The only thing which I feel is that why I use this word dynamic is that tomorrow, for an example, I was talking to a one of the topmost physician in the world in US. It happened to be a client of mine. He said, yeah, tomorrow there is the medicine for these things comes. So, I mean, then this whole vaccination process may also get over. I don't know whether it is true or not, because many doctors are on this panel. I may not be the right person. So I believe that we will have to deal with this crisis as it comes in. We are living in a scientific world. Every day there can be something else come. Tomorrow, yesterday I was reading somewhere that the vaccination may be ready, available in a single dose, that too through a nasal spray or something like that. So I believe that let us not criticize. We ask questions is good. I think we should, in democracy, we should ask the question. That is our right. But let's not criticize just the government just for the heck of doing it. That is where I have an issue, Barkha.
Okay, it's not for the heck of it. It's because people are dying and they may not have died had there been enough vaccines, and had the government taken the second wave seriously and preempted it, and had there just been enough vaccines, we would not be in this crisis. But let's look ahead. We have literally 2 minutes left, and I want to give closing remarks to Chandrakant, Dhiraj, and Shahid. Chandrakant, what should be the priority now in this vaccine rollout? Do you think that the government needs to standardize the pricing and the procurement to start with?
The central government should take responsibility for procurement immediately. Even the international tender should be central government centrally procured. They should ask state government that what is their requirement. Any state government want to purchase vaccine, the central government should issue a global tender. We have seen the power of global tender or centralized tender, that while Pfizer was saying that it will not supply vaccine or it has no spare capacity for 2021, now they have agreed for 50 million and they can agree for more. That's one. Immediately keep the expectations real. I think revisit the 18 to 44 year policy and tell people that come in August, and if early the vaccine becomes available early, we will vaccinate early, but don't give false hope. July to December, plan in the phased manner, open like in the stepwise manner, that first 41 to 44 and then 36 to 40 as vaccines become available. Once we are assured that we can have sufficient supply, then only open for all adults.
Dhiraj?
First of all, I want to say that I'm not one of those who's a reflexive critic of this government. In fact, I supported them on many things, and I continue to maintain that the India story is not at all over. But I think the point right now, as you said, is that people are dying. People, and I think that is, at that point, it doesn't matter whether it's Modi or Rahul Gandhi or anybody else in power. You have to, you have to do your job of criticizing to get the response from the system, because it's not only about Modi or one minister or one bureaucrat. The entire system needs to respond, and until that feedback comes from the ground, from your reporting or from my comment or from my analysis of data, I think we won't be in a good place. So I think the other thing we need, I think Professor Jameel alluded to it, is data. So, all this vaccine hesitancy and, wastage, let's get the data. We have already vaccinated 150 million people. There's a lot of data. Let's put that out as well. And let's put out constantly the data of the vaccines being procured, who's buying how much, where it's going. I think we need a dashboard. This government is very good at technology and putting up dashboards. Cowin, we've done the Cowin app. Let's have a dashboard so that every citizen knows what is being procured in which month and who it's going to in terms of states and who is going to in terms of beneficiary. I think that is critical. Without data, without that accountability, we won't get to our targets. So I would urge that, apart from, of course, procurement, which should continue to happen, put out the data transparently and let us all know where things are
these
going.
data are available, not completely. These data are purely available on the Ministry of Health. Put up the data of how much are we procuring and how these vaccines are being distributed to each state and how much time they are.
We don't know what's right now. We don't know what state governments are doing. We don't know what private sector is doing. That's 50% now.
That's precisely, I said, these. So sometimes what happens now, we hear social media should not be the source of information. I sometimes feel that I run a social media agency too, but then that should not be the source of information. Please go to the Ministry of Health.
No, 1 minute. What he's saying is that 50% of the vaccines are not reflected on that website because they're being not handled by government. They're not being handled by this.
Wrong. I tell you, 50% is central. No, 1 second. 50% central government is going to the quota of central government, which there is data saying how they have been distributed to each state on a pro rata basis, depending upon the population.
Yes.
Second is the 50%, wherein the state governments have been told to procure that. With 25% can be.
There is a third layer. Or can I say something and then I have to close? I'm responding to you only. I'm sitting at a private club in Bangalore, right? They have sourced these vaccines from hospitals at not at the rate, right? We have to pay like what at a lot of these private places, people are paying 2,000 rupees. You've seen advertisements now in hotels, like there are vaccine weekends being offered, right? So we are living in that sort of dystopian, unequal India, where there are village clinics that don't have vaccines and there are 5-star hotels. This is the village clinic I was in most recently, which said vaccine uplabdh nahi hai, right? So I'm just saying that to compute, when procurement and pricing is at 3 levels, it's very complicated. How are these private camps getting their vaccines? We don't know. How are they being able to procure it?
I will add one more scam.
Okay, another program on it another time because we've crossed an hour. I want to give Shahid the last word.
Some of the people who are buying in bulk, the rich people are buying in bulk and keeping it. So there is another scam. But this will all happen in such a large country.
But Shahid,
you can only try and limit it, enforce the law on these people. What can you do?
I want to just ask Dr. Shahid Jameel, what should and what can happen now? It is, as Swapneil said, a crisis situation. As you know, I think we are underestimating the crisis we are living through. Right? I think we're in such a hurry to declare the end of this wave, even though fatalities continue to be quite high.
So, Barkha, I'll make 3 very brief points. The first is that when the finance minister presented the budget, she allocated 35,000 crores for vaccines. I was very pleased to see that, and I just hope that maybe 25,000 crores out of that could have been put aside to procure vaccines at 250 rupees a dose. That would have procured 1 billion doses to vaccinate 500 million people. So I think Centre, as others have also said, should take over the procurement. Centre can do better pricing. Many companies from outside India will not deal with states. They deal with the country, with the center. So that's point number 1. Point number 2, we have talked about data and whatever everyone has said, I want to bring in another element of data. We have been vaccinating for a couple of months. We have by now given over 200 million doses of vaccine. We should really be collecting real world data on the effectiveness of these vaccines, which is called the phase 4 studies. We haven't really been doing that in any coordinated manner, and this should be prioritized and this should be done. We have people in the country who are capable of doing it. And my third point is that we really need to move with urgency and move quickly. Just to give you one example, Hafkin showed an interest in producing Covaxin in January. I don't think they have still signed a MOU with Bharat Biotech. 5 months. Why should it take so long? So let's move quickly. Let's forget about everything. Let's not look back. Let's look forward and move quickly.
Well, I
That's
just
it.
hope somebody moves quickly. In the hospitals we were in today, we finally saw the monoclonal antibodies being administered to people who have mild. I know Swapneil has a different take on it and we'll have a different show on it, but I was making a different point. It took a few months to even approve those. So approvals, the pace at which approvals are moving, if we are going to eventually embrace something, if you're eventually going to do something and you know you need to do it, it cannot take a few months. We don't have a few months. I think Dhiraj made that point that even December might be too late when lives, literally, there are very, very young lives being lost. And that's a very difficult conversation, but that's what's happening on the ground. We leave it there. Thanking our expert panel, learned a lot from all of you as always, and to our audience. See you tomorrow as we travel through South India, starting here in Bangalore with another ground report. Tomorrow's special will be on black fungus as we report from the inside of a mucormycosis ICU. That's what we're dealing with here. We now have an ICU dealing with mucormycosis. We are underestimating what the health system is going through. We'll have that special report tomorrow. Thank you for watching. Goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.